So, Stephen, what are some important advances or changes happening now on a state level or even a national level that NP should know about the NPA and that maybe they should get involved in?
Yeah, that's a wonderful question. And, if I could tell every nurse practitioner out there, they should join their state organization, their state NP organization, as well as their national NP association, which is FAANP, right? And then there's all of the specialty organizations that are out there too, right? And it could be overwhelming. And you say, how and why? Why am I going to use my hard-earned dollars to support this organization that I may or may not get a lot of benefit from? Well, I'm glad you're asking what the value is.
I want to know.
Right, exactly, right? So when we are talking about legislation, state legislation and licensure laws, that happens at the state level. And more often than not, the state NP organization is very aware of what those issues are and either has legislation that they're trying to get introduced or is working on legislation that has already been introduced to try and get it over the finish line. And that's why I think from a state level, it's really important to get involved. And, I think there's also the opportunity to not just pay your membership dollars, but understand what's going on from a professional practice perspective. I mean, at the end of the day, we are RNs first, right? We are nurse practitioners. We pay our money every registration period, and we are held to the standard of what is in the Board of Nursing and what's in the laws for our profession. And I will say, shame on us if we really don't know what's in there or what's not. Now, practice is complicated, right? And there's a lot of gray areas, but we should have an understanding of what it is we do and what we can and what we can't. And if there's something we can't do, and it's something that we've been prepared and educated to do, well, why can't we do it? So usually we have to look at from a legislative perspective. So maybe it's a law that was written, or maybe it's an old law. So where we are in New York State is this. In the law that passed in 2014 was called the Nurse Practitioner Modernization Act. And this was a law that for the first time would allow nurse practitioners with greater than 3,600 hours of clinical experience in the state of New York to no longer have a written collaborative agreement with a physician. Instead, they can opt to have a collaborative relationship with a physician or a hospital. So really, for the first time, it said, the law said, if it passed, and it did, that these experienced nurse practitioners don't need this written agreement. So that was what we were working on for a long time. And I will say that wasn't everything that we wanted to go around and to pass, but that's what we thought we could get at the time. So it did pass in 2014. It became effective in 2015, and it had a sunset attached to it. And a sunset date is when, if the legislature doesn't do anything to extend the bill, then it would go away. It would go away and revert to the way it was back in 2014. Well, we didn't want that to happen at the Nurse Practitioner Association of New York State. And, we thought that this was an opportunity for us to actually make some enhancements. So we have an ability to make it permanent, but to also make some enhancements to it. So that sunset date happened to be June 30th of 2021. And what happened, what was happening in June of 2021, but, a pandemic. And it so happened that the legislature did not let the law expire. They extended it one more year. So as of today, and I'm going to say it's January, right? Late January, early February. Nurse practitioners in New York State still can practice under the Nurse Practitioner Modernization Act, but that sunset date is on June 30th of 2022. We need to get a new law passed, an amendment. An amendment to the Nurse Practice Act is essentially what we're doing or trying to do. That would make the Nurse Practitioner Modernization Act permanent and would also eliminate that language of the collaborative relationships and just make it clean. So nurse practitioners with less than 3,600 hours still need a written agreement. And we could talk for a long time about the concept of transition to practice and whether those transition hours should be a thing or not. And there are states that have 0 transition to practice hours. There are states that have, 2 or 3 years transition to practice hours. And, that's somewhat, controversial. And the reality is there's really no evidence to say what should that time be, if anything. But again, in New York, we're hoping that this new law that will pass is the less than 3,600 hours still have a written agreement. But after you hit that 3,600 hours, you can practice at the top of your license, which we have to do already, right? But we need this mandated relationship. Without that relationship, technically nurse practitioners can't practice. And what I always found odd about that concept was nothing really changes if there's a collaborating physician or not, right? Like we have a network of colleagues that, I said this earlier, no one knows everything. And hopefully you are reaching out to your colleagues who know in X area that this is how, I have a question or this is an odd reaction, and I can speak to my colleagues about that. But, and that's what we do as professionals, right? That's what I would hope any professional would do when they came across anything that they didn't know. But when that is mandated in law, and I can't practice at all without this component being there, then that's a problem, because nothing really changes. I mean, I've heard stories, right, when I went to those town hall meetings and I was listening to why this law should be passed in the first place. And there were nurse practitioners in rural areas of New York State. A lot of times we think of, the city for New York, but there's a lot of rural areas of New York State. And there were nurse practitioner practices that were the only primary care game in town. And they were paying their collaborating physicians, whatever it was a month, just for the ability for them to stay open. So they could just see patients, right? Well, it happened that those nurse practitioners, their collaborating physician came to them one day and said, I took a new job and I can't collaborate with you anymore. I'm sorry, I have to rip up our written agreement. Well, at that moment in time, those nurse practitioners could not see a patient. Like they could be accused of professional misconduct because they didn't have a written agreement, and there's no grace period. Like if at the time you didn't have a signed agreement with a physician, you can't see a patient. And it doesn't matter that your schedule for that day had 25 patients on it. You couldn't see a patient without that written agreement. So it really didn't make a lot of sense. And it was those stories that really, prove that point as to, why these laws need to change and why we need to sort of modernize those nurse practitioner laws. And that's all at the state level, right? So, every state, now there are some states across the United States that have full practice authority. These are nurse practitioners in their Nurse Practice Act do not have this regulated agreement with a physician. I always point to the map that FAANP puts out, and they have this map that shows green, yellow, and red, and the states are green for full practice authority, yellow for reduced practice authority, and red for restricted practice authority. And the yellow and the reds, means that there is some physician involvement from a licensure perspective, that you can't do what you've been educated, taking board exams, right, taking your national board certification test to do, unless you have something in place that allows you to practice. So, So that's going on in all those other states. And then you mentioned about like at the federal level, and then there's Medicare law, and that's at the federal level, and there are many things that are going on that has to pass Congress, and has to go through Congress and be signed by the president in order to change. And one of the recent changes was back in 2020, the CARES Act, for the first time, allowed nurse practitioners to order home care services. And because prior to that, nurse practitioners were not recognized by Medicare to perform the face-to-face visit to order home healthcare services. And I've always thought about, when we talk about home healthcare services, we're largely talking about nursing services. And if nurse practitioners can't be the ones to order nursing care, what is wrong with this picture? But it came down to is that technically we could order home health care, right? There was no state law that said really nurse practitioners can't order home health care. The problem was that the home health agency that is billing Medicare would not get paid by Medicare if the order was written by anyone other than a physician. So for the first time that changed, and that's not, it was like happened overnight. There were bills in Congress that had been introduced and were not passed years and years and years. And finally, this was an opportunity to put it in the CARES Act and make it law. And now I say this with, there's always an asterisk when you talk about state law and rules and regulations, but generally speaking, nurse practitioners now across the United States can order home health care services, and Medicare will pay for those services.